Welcome back to our ongoing discussion about the different documents required for a accredited or CAATE accredited athletic training professional program. And we're going to talk about two different documents that I've attached in the lesson area. They are the Accreditation Standards, both for a professional program, which again is at the entry level, and then the post-professional standards. So what are these standards about? They're designed, and it's out of the professional standards, to be used for the development, evaluation, analysis, and maintenance of an athletic training program, of athletic training programs. So it's basically how to do the thing. If you look through it, don't expect you to read everything in these two documents. They're pretty detailed. You'll see that they are very detailed. In fact, I'm looking at the professional AT programs standards. They address 11 different points, and it's very, very detailed. It takes a lot of work to write a proposal to start and maintain an athletic training professional program. It's just not the athletic training faculty and staff that are involved. It's actually a university proposal that has to be turned in to CAATE, and then after you turn in a proposal to start a program, the CAATE sends out what they call site visitors, and the site visitors are on site for a couple days, making sure that what you've said in your document that is correct. Do you have the personnel? Do you have the monies, the facilities, and all those type of things that you say in your report that you have to turn in? Is it actually there? Some of you may have actually been students or around when programs have gone through their accreditation process. And every 5 to 7 years, an athletic training program has to go through a re-accreditation program, and they have to do self-report at those times. And every year there's an annual report. So it's a lot of administrative work. As some of you have been athletic trainers longer will know that we end up doing a lot more administration work than clinical work at times. And that's one of the reasons why there's an administration course in this grad program, because I realized that pretty quickly that my role is highly academic or administrative. So I could spend a lot of time in the post-professional standards. I just want to talk about in the undergraduate or graduate professional programs, we had those core competencies that students are expected to meet by the time they finish their program. At the post-professional program, which is our program, again, we're just not an accredited post-professional program. If we were going to go towards accreditation, I would have to make sure in the document that I have to write up, because it covers those same 11 bullet points in the post-professional standards, we would have to demonstrate that we are meeting these 6 core competency. How are we teaching evidence-based practice throughout the grad program? And what about interprofessional education and collaborative practices? How are we teaching students to use other medical communities and be in partner with them? How do we make quality improvements in our healthcare that we are providing our patients? What is healthcare informatics? This is the electronic record keeping and all the other way that we do electronic or other formats for providing healthcare for our patients. How else do we teach our students to be a professional beyond what they were taught in the undergraduate level or at the entry level? And at the center of it all is patient-centered care. These are all intertwined with one another. It's not my goal here to try to explain each one of these. These are just like a real rough summary, because you can read in the document more details about these. So those are the standards for the two different levels of athletic training programs, just to give you some information about all the requirements of running an athletic training education program or a professional program. It's pretty involved. The program directors and the clinical coordinators and the other faculty members have a lot of work to do every year on the administrative side to make sure that they can maintain the accreditation.